Tēnā koe. Thank you, Susan. Tēnā te mihi kia koutou. Lovely to be here with you today. Yes, we have. And what I would say is that Rau Awa Awa is quite unique in the sense that we are led and governed by kaumātua. And that so it's really hard to go off track because they pretty much drive the vision, but they also drive the priority for the organization as well. And of course, dementia is a really important kaupapa. Our very first, even though we identified that the need was growing in the earlier years, it was really Alzheimer's New Zealand that funded our very first community-based dementia program. And so we're always grateful to Catherine and the team and the board for that. And then, of course, Professor Makarena Dudley and Kathy Perry also did some training with our team a few years ago on cognitive stimulation therapy. And so we've been able to kind of improve what we do. But of course, community-based organizations, as many of our age concern and our charitable groups will know, is that you have so much capacity and you have so much resources, and there is really so much demand. And that's so technology, Susan, I see as a real tool to enable what we as human beings can't necessarily get to in terms of capability and capacity. But I loved what Erica said around, technology isn't about replacing whakawhanaungatanga. It's really complementary to that. And very much like what Simon just mentioned recently, is that because virtual reality, we actually trialed not long after COVID. So we brought it into expos in an attempt to try and draw our kaumātua out into new spaces and see if they would be willing to trial it at an expo. It was such a hit, Simon, that we ended up taking it to the kaumātua Olympics. And the challenge was that as teams got to their break and had a chance to trial the virtual reality, they didn't want to move when the bell rang for moving on. So it is such an exciting area and piece of technology to be brought into our older people's space. And so, for us, I guess in terms of the work that we've done, some of the things that I kind of nod to is around personalization. So for our kaumātua and for Māori is like engagement is so much easier when you see yourself in whatever is presented to you. So if you see Māori design and if you see or you hear te reo in technology, it's just so much more engaging for our older people. And that much like any ethnicity, I would say, is that you want to form a connection from the very outset if possible. But with Rai Awa Awa, I think in terms of design, because they are our leaders and because they're very much a key part of our operations to not our board, but another group of kaumātua called our Kotahitanga Committee, it means that they're always shaping, I was going to say correcting, but I'll say shaping us as their team, as their workforce to make sure that we get it as right as we can. But we're not perfect. We do it, we learn, and we try to improve. And that's how we keep moving forward on that particular kaupapa. But yes, Susan, some exciting things often brought about because our kaumātua have identified something, they want something done about it. We may not have a lot of resources, but we've got a lot of bright minds and we've got a lot of really intelligent mates like Okiria and there, and like Makarena, like Nairikus, we've got a lot of people in different spaces that we can reach out to, like Lanita and that in Alzheimer's New Zealand, and actually just ask a few questions to help give us a bit of guidance. John Reynolds and Louise Parr Brownlee have been really key for us in helping us, just giving us advice to help us design some cognitive health games. So when we first started, we in the community we throw around words, so it was like brain training games, and then realize that actually you need to have a little bit of a evidence base to kind of call things that. So it's we're learning all the time. We're based in the community. We're driven by our kaumātua, and they're really clear on what technology needs to look and feel like. And their thoughts are If it's designed for kaumātua, then it should have them as part of the design team, right through to implementation. Um, if it's about kaumātua, they're the experts of their own lives. So it's about making sure that their voices are prioritized in whatever it is that you're trying to bring to support them.
Fantastic.
Yeah.
That's such a cool message. So we've got that idea about personalization coming through, and that idea about, we use that phrase co-design, but people are experts in their own lives. I love that concept. And another thing that I'm kind of hearing coming through is something that, some of us really, it's quite a subtle thing, but playfulness is not the same as childish, is it?
Absolutely. I think, there has to be room for both. So if you ever attended a Kaumata Olympics, you'll see that there's no boundaries in that to how our Kaumata might interact with different games. So we have a noodle game. And, in of itself, it's absolutely harmless. But when you get some competitive older people facing off and from different rohe and iwi, then it's no longer just a simple game, and that it can be actually quite a health hazard. So we're revisiting that particular game. But yeah, so I would say that we've worked on 4 games through the funding from Selwyn Foundation. So we were really privileged to be able to be funded by them to develop these games. And we worked through with our kaumata around what sort of things that they might like to do, what's common for them to do. And so these 4 that have been developed, and that's currently just sitting with the Selwyn Foundation to review before we can just share that with yeah. So we'll share it with you, Susan, and feel free to share it out to this lovely community who are all working in the Dementia Mate Wareware space.
Oh, we will be looking forward to that. Now, for you and for Simon, we just have a question that has come through about whether you had any people who, with the virtual reality, it made them feel a little bit motion sick, and if you have any tips about how you can reduce that.
Simon, you're the expert. I'll let you go.
Yeah, no, happy to jump in here. So yeah, there's a couple of things here. So first of all, it's important to know that VR may not be for everybody. So there's an important consideration there and thinking about the person's preferences. There's also important consideration around their medical history that need to be borne in mind if you're going to provide an immersive experience with somebody. The research shows that we've done has showed that about 1 in 10 people will feel a level of motion sickness when they experience a VR experience. So that needs to be borne in mind. That said, there are definite things that can be done to make sure that the VR experience is delivered in the right way for the individual. So there's specific protocols that we've kind of authored and have had some great support from people on this call, actually. So thank you to everybody who's been involved in that. But it can be very much a case of selecting the right experience for starters. So if you know that potentially there's a risk of that motion sickness or eye strain, things like that, then you would select an experience which is much more gentle. So it might be just sitting on a calm beach or in a forest or something which is quite static, as opposed to something which is more high movement in its kind of makeup. So, you wouldn't go straight for dolphin swimming, for example. So there's things like that. There's also VR can also be projected onto a screen, so you can actually engage people. Some people wearing headsets, some on the TV screen, to make it that shared social experience. So there's quite a few sort of tips and tricks to make it as effective as possible for people, but obviously bearing in mind their individual needs. And I can touch more on that if people are interested to learn.
Well,
I
thank you
think
so.
that's, oh, sorry, Susan, I was just going to say that's pretty consistent with what we ended up doing, was providing a seat for people to sit at, having the screens there so that whānau or other kaumātua could see what was happening first, because then for some of them they weren't too sure. So having the screens that they could see what was going on also meant that that kind of stimulated interest, but also gave them a sense of, oh, it's not that scary after all. So it was about just, I guess, finding ways to make it acceptable. and just reduce any sort of inhibitions and around what might be happening to people when they put those on. And we limited the time that they spent on there. One, because there was a line of people that wanted to trial it, but two, because it was, we had it for a short period of time, so we limited it as well, just to make sure that everybody got a chance to do it. So.